Good afternoon. Thank you for joining us for the second webinar. For the next couple of ones, we'd like to be more focused on the core knowledge needed to determine the amount of medical assistance needed in each type of vascular pathology and try to revise the concepts which were mentioned previously. We'll start with reviewing one of the most common tumors of infancy, infantile hemangioma. Well, as for the epidemiology, we know that it appears in every 100 newborns all over the world, and probably with a threefold female to male ratio. We also must say that the changing of the epidemiological situation in the past decade merit consideration for medical treatment. And just before Dr. Romanov will start his talk, we'd like to once again kindly remind you that important variables to consider in the treatment of vascular lesions are size, depth, and composition. And localization of vascular tumor plays a significant role in determining an appropriate treatment plan too. Layers of hemangioma are presented here, so as the predominance of each layer and the cell composition may vary, the effective treatment using laser-based approach requires tailoring the light wavelength, fluence, and pulse duration to the specifics of the target lesion. And as the target for vascular lasers is hemoglobin, it's crucially important to select a wavelength with deep enough penetration to at least the depth of the target. In this case, the energy is absorbed selectively by it within the range from 532 and 1064 nanometers. Shorter wavelengths scatter more quickly and penetrate only about 2-3 millimeters into the dermis before scattering and cannot be absorbed by the so-called chromophore. Also, the heated target has to cool quickly enough so that it doesn't cause thermal damage to the surrounding tissue. Next, I'll focus on phases of infantile hemangioma, and once again, I'd like to remind you that according to the level of the affected tissue, these tumors can be superficial, meaning in papillary dermis, or deep in the reticular dermis, fat and muscle. As proliferative phase consists of cellular masses of capillaries with small rounded lamina lined by plump endothelial cells that are surrounded by pericytes. As a result of high blood flow, draining veins become enlarged with thickened asymmetrical walls, and infantile hemangioma don't show intravascular thrombosis, hemosiderin disposition, or necrosis, well, unless secondary to ulceration.
Well, in the involuting phase, lesion capillary graduality dissipate. Basement membranes thicken in the show embedded apoptotic, thus the pericapillary mast cells increase in number. In the late involution phase, near end stage, lobules are replaced by loose fibrous or fibrofatty stroma, with only few residual vessels which remarkably preserve their immunophenotype. So as the clinical subtypes of hemangiomas, superficial, combined, and deep, are recognized depending on depth of the skin penetration. The choice of a wavelength depends on it too. It also has to be mentioned when the proliferative periods typically last until 6th month for superficial hemangiomas, though deep hemangiomas may proliferate longer. After aggression, many hemangiomas leave behind residual fibrofatty tissue atrophy and/or telangiectasis. That's why, when we are choosing a treatment plan, we always have to, first of all, define exactly the structure we are going to affect. Moreover, by highlighting the key principles of laser treatment, I could not to mention the appropriate heating of the target is a balance between the rate of photon absorption and the rate of cooling. By that I mean every doctor, including myself, always has to keep in mind the concept of particular target's thermal relaxation time, which extremely useful in clinical practice to pick the correct pulse duration. It's simply defined as the time required for substantial cooling of the target structure. For example, a 1 mm vein cools in about 1 second, while a vannula in a child cools in about 1 millisecond. The optimal laser or IPL pulse duration is typically about equal to the thermal relaxation time. The matching of the thermal relaxation time and pulse duration is clinically important to achieve efficiency, avoid side effect, and even to define the target that will respond. The matching of a thermal relaxation time and pulse duration is clinically important to achieve efficiency, avoid side effects, and even to define the targets that will respond. That's why if infantile hemangioma is in the late involution form, we commonly choose 542 wavelengths, meaning to affect only superficial vessels is not to cause its pathological growth. While dealing with the combined hemangioma might be tricky, because here we have two components to affect too: superficial red structure managed using the 532, which is also known as the KTP, while the deeper ones reached by 1064, also called a long pulse one, are usually at first effect the deeper structures and then influence the red components by using the KTP. And the last but not the least principle of laser treatment of infantile hemangiomas is that in the deep ones our main aim is to remove the volume of the tumors and affect the pathological vessels. So as there is no, or let's say not enough to cause a metahemoglobin wall for the further long pulse interaction. We use a KTP to remove telangiectasis and then get the work done with all the deep dips by moving to the center of the tumors, not from it. The next question we face in our clinical practice is the number of required sessions. The period of renewal of epidermis is about 1 month, so it actually determines the frequency of session and averagely the number of required treatment per lesion varies from 3 to 5 as generally our goal is to increase involution capacity value of the tumor. Otherwise, the estimated effect might decrease, or let's say the undesirable brand product is going to be formed. Another thing to keep in mind to achieve the better results, we avoid such complication in that the one target needs approximately 2 flashes. Children who undergo laser surgery require general anesthesia if we use a long pulse wavelength, or the tumor is located in periorbital area, or if it requires more than 50 flashes to be done, or if a child has any contraindication to local anesthesia. Otherwise, topical anesthetic are applied to minimize the physical and emotional distress children may experience during the procedures, and we must say that it doesn't decrease the estimated effect of the laser treatment at all. Another important thing to say is that afterwards there is no need to apply any extra topical anesthetic solution. However, we always try to draw the attention of patient and more likely their parents to the importance of a proper skin care after the laser treatment has been performed. I first will briefly summarize the main issues. Why should we start? First of all, the user laser when the beta blocker therapy has already been ineffective or a child has any contraindication to it. Another reason to proceed is so-called the high-speed effect, when somehow we change the structure of the tumor and change to move through her involution phase faster than generally of the case and represented the cosmetic defect management. Before I move on, I'd like to recap the main points to keep in mind when applying a laser treatment, which are highly associated with the complication occurrence. Due to our experience, beyond the ones listed, the immunological status of the child and his general health may be the reason of holding the surgery aside. So, here is a clinical case of a patient who undergone the monolaser therapy. We have chosen less fluence when it is presented in telangiectasia mode. However, we have been increase it from session to session. One is old female patient who had not previously undergo medical treatment for her combined infantile hemangioma. Two procedures were done under the topical anesthesia. The next case, 2 years old male patient who had previously undergo medical treatment for the infant hemangioma, but parents were not following the prescribed beta blocker therapy treatment plan. So we performed 2 surgeries under the general anesthesia and used the topical anesthetic in the most recent one. Here's an example when the laser treatment is a supplement to the topical beta blocker therapy. The first one shows the tumor before any treatment was prescribed. The second one has been captured before the laser surgery was performed. The last one is showing the results after 2 procedures have been done. This patient had a previous history of systemic beta blocker therapy during 2 months, and when the laser surgeries were performed. So it represents a case where a laser treatment is an adjustment to the systemic medical one. Due to tumors localization, they managed first to under the general anesthesia using eye shields and then continued with only topical anesthetics. The results of this treatment are shown here. As has been already mentioned, if the beta blocker therapy has been ineffective, we proceed with laser treatment and follow internationally recognized clinical recommendation not to perform more than 3-4 surgeries ear. Well, speaking of a particular case, our main goal was to get a child emotionally prepared for school, or should I say try to do our best in managing his cosmetic defects. Okay, let me now turn to the issue of a topographic skin thickness value. It actually is an important one to remember when thinking of a setting which should be applied in each case. So regarding the points, let's take a look on the setting which were used here. As you might have noticed, the treatment was done with a hand of a general telangiectasia mode. However, here the fluence was slightly reduced to avoid the side effect, and the surgery was performed under the general anesthesia. And finally, I'd like to address the problem or complication which may occur if any of the key principles which I tried to at least briefly discuss somehow were compromised or not taken into account. The first pictures is representing a case when a KTP causes a pathological growth if applied before the involution phase. And the second one, well, have you ever been in the situation where you know when do you done everything properly, however a few weeks a child returns to you with, let me put in this way, to fair and disable results. I remember now shocked I was when her mom sent me this one. Well, it turned out that a child was ill on the day of the surgery and mother gave the meds, so girls' lab tests were compromised. Or should the triple check every lab test to be always able to reach the desirable results, or at least, you know, to avoid voice one. So where don't we don't from her? Or should we triple check every lab test to be always able to reach the desirable results, or at least, you know, to avoid those ones. So where do we go from here? Is everyone still with me? Hope so, because I like to summarize that I've said so far and propose to divide all problems which our patients face into two groups: life-threatening ones and those which are best over psychological and aesthetical needs. So, the first one will be all the complications which commonly appear, meaning cutaneous ulceration, bleeding, the high risk of infection, and related changes which lead to reduced or decreased organ function, meaning whether it is an airways obstruction, on congestive heart failure, or amblyopia, when lesions are blocking the visual exit. Let's now look at the next slide, which show that not only functional sequelae are the common reason to the start of procedures, as early treatment may help minimize the scarring associated with hemangiomas and the psychological distress that might occur with the watch and wait approach. Hemangiomas on the nose, lips, glabella, and on the chest in females may be considered cosmetically sensitive. Which brings us to the next question. We must agree the criteria allow us to use those ones which have been specifically designed for improving the life quality of a child and in many cases the whole family.
Well, as a final point, we'd like to share with you some latest cases to take a look at and then think about an appropriate treatment plan. We will stop for a while and then Dr. Romanov is going to show his point of view and we will later discuss all questions you might have in our Q&A session. Thank you.
This is a 7-month-old female who is going to have a laser treatment under the general anesthesia. I hope you remembered, as I pointed out few sessions ago, we have to slightly decrease the fluence if hemangioma is located over the place with a great epidermal skin thickness. This is a 6-month-old male who is going to have a laser treatment under the general anesthesia. And once again, we manage the fluence rate up to the skin thickness value. Okay. Well, for the last one, he will present a 60-month-old male patient. As a child has a contraindication to beta blocker therapy, we decided to proceed with a laser treatment under the general anesthesia and to combine long pulse and KTP. We hope you found today's webinar helpful. So thank you very much for your attention, and now it's your turn. So